China has now reported more than 72,000 cases of the coronavirus, including more than 1,800 deaths.
At the moment, we don't have enough data on cases outside China to make a meaningful comparison on the severity of disease or the case fatality rate. We're following up with countries to get more information about what happens about each case and the outcome.
The WHO Director General said it's crucial for impacted countries to be transparent and share information with the World Health Organization so it can help.
These signals show the importance of all countries being ready for the arrival of the virus, to treat patients with dignity and compassion, to protect health workers, and to prevent onward transmission.
Professor Eileen Marty says the reaction by some governments has been inconsistent.
Some governments have been more strict, some less. Some have imposed trade barriers, some have imposed travel barriers, and the degree of those barriers differ by the different places and their own capacities.
Regarding the spread of the virus on the docked Japanese Diamond Princess cruise ship, Michael Ryan, executive director of the WHO Health Emergency Program, says there have been more transmissions than expected.
It's an unfortunate event occurring on the ship, and we trust that the authorities in Japan and the governments who are taking back people will be able to follow up those individuals in the appropriate way to ensure that they get the appropriate care if they are cases, and if not, that they are reintegrated into their communities.
And while vaccine development is important, experts say it's not necessarily a top priority at the moment.
We all want to invest in the vaccine as a long-term solution, but there are people sick now, and there are health systems that are vulnerable now. So we need to balance our investments and invest in the weaker health systems, on our own systems, and then we do the other things and we develop the vaccine.
We have to make sure that that vaccine doesn't hurt you. So safety studies, and that takes time. That takes at least a month or 3 months to put people, to have volunteers use that and see people who aren't even exposed and see if they have any risk.
Julie Taboh, VOA News, Washington.